What is reactive attachment disorder? Is RAD permanent? Is RAD curable? What is reactive attachment disorder? Reactive attachment disorder, RAD, is defined as a problematic pattern of developmentally inappropriate moods, social behaviors, and relationships due to a failure in forming normal healthy attachments with primary caregivers in early childhood. A child who experiences neglect, abuse, or separation during the critical stages of development during first 3 years of life is at risk of developing an attachment disorder. How serious is reactive attachment disorder and can it be cured?
RAD is a diagnosis with the potential for lifelong implications. While there are effective treatments for attachment disorders, they require intensive interventions and not all children respond positively. Can RAD be cured? While it's possible for children with RAD to heal, most will continue to have some personality and relationship issues into adulthood. It's important for parents and caregivers to adjust expectations accordingly. We now understand that early childhood trauma has lifelong, often devastating impact. The results of this are seen in the lives of children with RAD. While RAD is serious, it's important to recognize that there is much hope. Many children who were diagnosed with RAD have gone on to live productive lives, get married, have children, and establish relationships. Yet it's also necessary to discuss that many of these children are not able to maintain life in typical homes and communities, and this is not the fault of the parents.
What is the best treatment for reactive attachment disorder? Attachment therapy with a qualified therapist is the best treatment for attachment disorder. Traditional play therapy or cognitive behavior therapy, CBT, is rarely effective and can be harmful because the child tends to triangulate the parents and therapist. Other treatment modalities such as medications, animal and music therapy, physical and occupational therapy can be helpful, but attachment therapy should be the primary focus. Does RAD go away? Is RAD permanent? Attachment disorder does not go away as children get older unless intensive therapy and intervention is used. RAD is a diagnosis for children, so a person with RAD who does not receive treatment will have a different mental health diagnosis as an adult, most commonly narcissistic personality disorder, borderline personality disorder, or antisocial personality disorder. How do you discipline a child with reactive attachment disorder? Children with RAD need extremely tight and firm boundaries. These children are highly charming and manipulative. Even the most trained therapists and social workers are often fooled by the child's behaviors. Because many children with RAD are self-seeking and do not have a healthy conscience, they will cause harm to other children and animals without remorse. Can people with RAD love? No. Children with extreme forms of RAD cannot give and receive love in a true form because they are lacking the necessary attachment. As they heal from trauma, they begin to develop empathy and the ability to love and have relationships with other people.